Hello, this is Tyler White with Survivopedia. We're going to talk to you today about hypo and hyperthermia found in the Survival MD book. What to do when there is no doctor. Hyperthermia. What is it? Hypothermia is getting too cold. Hyper or elevated thermia is getting too hot, in a nutshell. There's a lot of things that you really need to know about that, and it can be found on page 166 of the Survival MD book, What to Do When There Is No Doctor. Hypothermia and hyperthermia. Hypothermia appears when the body temperature decreases below its normal operating range. Normally, the body's temperature is somewhere between 97.5 to 98.8 Fahrenheit or 99 degrees. There are people who are not considered to have a fever at 99, and it's a good idea to have a thermometer in your survival kit because change in body temperature in either direction can have serious consequences. If your temperature falls below 96.8 degrees Fahrenheit, the more it decreases, the number you will feel. Somewhere around 93.2 degrees, you lose consciousness, you are in a coma. What you need to do in case of hypothermia is to warm the body, but you don't want to warm it suddenly, you need to warm it gradually. Going down to hyperthermia, hyperthermia or fever means that the temperature increases to over 100 degrees Fahrenheit. At that point, the person can enter into hyperthermic shock. It happens in the desert, in the cases of heat exhaustions, and in cases of infection so severe that the body reacts by inflammation that raises the temperature, and then you must lower the temperature. What you need to do from a medical point of view is lower the fever. Using cold compress, wrap, cold water, soaked fabrics, drink a lot of liquids, treat the cause. It's not advisable to take antibiotics in the first 3 days of a situation like this. Hypothermia. This is when you get too cold. One test that we like to use in survival instruction classes are the finger tests, right? So if you can go 1, 2, 3, 4, 4, 3, 2, 1, 1, 2, 3, 4, 4, 3, 2, 1. That's pretty quick. I'm not cold, right? As you start to get cold, you may not even feel cold. You may not even be shaking yet. But one of the first things to go is dexterity. You won't be able to move very fast to do your 1, 2, 3, 4, 4, 3, 2, 1. When this starts, that's the initial stages of hypothermia. That's when you know that you're starting to get cold. Your external body parts are shunting blood to keep them at your core and your head in order to preserve your vital bodily functions, your organs in your brain, and keep them from freezing. This is the place that we need to stop the process, that we need to get warm, put gloves on, get circulation going. And I've found one of the best ways to add heat is at the kidneys. The way that the body creates heat is with the blood. There's chemical reactions that are like little flame, right? It's not literally flame, but it's a chemical reaction that creates heat. That's how we keep our bodies warm. Excreting sweat and evaporating is one of the main reasons, or one of the main ways that we keep our bodies cool. So knowing that blood is the thing, the radiator fluid, if you will, that brings heat in and out, that should tell us that there are certain places in the body that we can add or remove heat. The armpit, where I have blood vessels, arteries, and veins close to the surface of the skin, the groin, the neck, and the kidneys are some of the best places to add and remove heat. So if you have those little hand warmers that you start shaking, people will put them on their hands. The reality is you want to put a bunch on your kidneys. If your kidneys are warm, then that heats the blood up and the blood gets pumped everywhere. Put more on your hands, put more on your feet. And I've found if you can keep your core warm with a vest or some sort of centerpiece of clothing, that your extremities will take care of themselves. So don't worry about warming up your hands when you're cold. Warm your body up. Your body will warm up your hands. Your body will start releasing that blood and sending it out and getting you warm again. The other thing that is a big failure when it comes to hypothermic situations is usually water, right? When it's so cold that the water freezes out of the air and falls to the ground in the form of snow, you now have 0% humidity in the air. That means all of the liquids of the water that you're exhaling is leaving the body. You're actually losing water faster than you would just sitting in an environment like this where I lose some of the water, but I breathe some of the water back in. The way to rectify that is add a lot of water. There's nothing wrong with heating it up. That's why in a survival situation, we like to make a stew. Drink the stew, and it's going to give you vitamins, salts, nutrients, and water. Now, hyperthermia, meaning that you've gotten too hot. One of the first things that you need to do is take away the heat source, right? Get out of the sun, get out of the suit that you're wearing, whatever it is that's creating that heat. Get in the shade, stop moving so that you're not generating as much heat. And if you get to the point where you stop sweating, you're really starting to get in trouble. You need to continue to sweat. If you don't sweat, force feed a bunch of water, not too much, but in the military we would chug canteens until we peed. When you start peeing, you know your body has replenished itself. But when you're taking in that level of water, you have to add salts. I like to chew on and use pine tree needles for vitamin C. I bring chunks of salt when I do survival classes. Salt is extremely important because it is essentially the chemical that keeps your batteries running, and it keeps that brain functioning, and it helps you to make good decisions, which you're not gonna do once you start to get into hypothermic shock, hyperthermic shock. So you're too cold, get warm, warm up the kidneys, drink fluids. You're too hot, drink fluids that are cold, put wet towels and so forth on the outside of the body, get in the shade, and cool down. Okay, hopefully this is valuable to you. This book is called Survival MD, What to Do When There Is No Doctor. This and many other medical pieces of tidbits and information are inside this book. I think it's a phenomenal resource. Thank you for watching.